We are in the midst of a digital age where technology is advancing at an unprecedented pace, fundamentally transforming every aspect of our lives, including healthcare. Artificial intelligence is at the forefront of this revolution, disrupting traditional practices and ushering in a new era of efficiency and precision. AI is set to change the healthcare landscape in ways we've never imagined, and it continues to evolve. Its influence on the workforce and the way we deliver care is both profound and inevitable, paving the way for innovations that we once thought were impossible. From real-world applications to future possibilities, this is one conversation you don't want to miss. Welcome back to Healthcare Disrupted. We're here with an exciting new episode, and we're going to dive into a topic that may be one of the most divisive and talked about conversations within healthcare today, AI. And I'm here with a friend and a guest. I'd like to welcome everybody, Saad Chaudry, our Chief Digital Information Officer here at SSM Health. Welcome, Saad, and thank you for being here.
Thank you for having me, Amy. Yeah, happy to be here.
So tell me a little bit about yourself, Saad, and how you got into Chief Digital Information Officer roles, your technology background, and how you landed here with us at SSM Health.
So I've had the good or bad fortune, depending on how you see it, of being in healthcare pretty much my entire life. I was born into a family of physicians. I'm the first person in 3 generations not to be a physician. So, the apple does fall far from the tree sometimes. I went to daycare and hospitals. I did my homework after school in my parents' clinic. And it's actually there that I used the first computer. And I'm going to date myself here. In the 80s, it was an IBM 286. And I figured out how to not only turn it on, but play video games on it. And that was it. There was no looking back for me. My deal with my father then became that I could play all the video games I wanted on this thing and I could play around with it as long as I did my homework, A, but B, as long as I helped his clinic folks, the people that worked at the registration desk and so on and so forth. I trained them how to use this computer as well. So that sort of started my journey into what would one day become known as healthcare IT. In those days, that wasn't a thing. Yeah. Went on to get my bachelor's in computer science with a focus in healthcare. That was also very unique for the late 90s. Did a master's in communications and information systems, and then a second master's in healthcare policy. Have only ever worked in healthcare and healthcare tech specifically. So had the opportunity also to branch out within healthcare a little. I worked on the insurance side, worked on the commercial side. I was a programmer for electronic health record systems, which should scare everybody. There's somewhere out there's a hospital running the code that I wrote. And I went on to also serve as a CIO for an organization abroad, only for a couple of years, only for 2 years. But that also allowed me to see healthcare from the outside in. Being in the United States, our spectrum is so broad with healthcare. And so sometimes it can often feel insulated. And we sort of focus in on our own problems within the confines of our borders, which is A-okay because, we have a lot to do. But sometimes just stepping away. And for me, that was in the Middle East and Northern Africa region. Okay. Just stepping away and seeing how other countries approach their healthcare, how they invest in healthcare innovations, both operationally and technology-wise, was very, very helpful. Allowed me to get out of my own skin and comfort zone. All of this build up, I feel like was almost by fate or plan somehow to allow me to enter SSM Health one day. Because at SSM Health, I joined a little over a year ago. I started out as the Chief Digital Officer. And the idea there simply was, how do we take the technology that we have invested a lot of money in, a lot of time in, a lot of effort in, and how do we actually change the way we do work? It just so happens that journey coincided with another journey milestone for our CIO at the time. And so she announced her retirement. And at that point in time, we combined both roles, which ended up with the role that I'm in today, Chief Digital and Information Officer, the scope of which is IT, of course, and all the things that are ancillary and surrounding IT, from analytics to informatics to digital health, but then also allows me to sort of dip into the operational side.
Sure.
which to me is actual digital transformation. It's less about the technology and it's more about the operations. And so currently, I'm also overseeing facilities management, real estate operations, and physical security.
Great. Well, every time I talk to you, Saad, I think I learn something new about you and learn something new about your background. And, it's interesting. I know you started really early working in your father's office, and then all of the experience that you've had abroad, all of that coming together has really served you well and serves you well within our organization now and gives you a breadth and depth of experience that not many people have. So we're fortunate to have you, and it's been a lot of fun since you've been able to join us. So let's dive into our conversation today. We're going to talk about AI, artificial intelligence. And one of the things that's been frustrating to me as a clinician, as we've started to think about generative AI, it feels like to me the AI topic has gotten really broad and all encompassing. And so some of the things that we've done in healthcare for a really long time are now falling under this AI umbrella. So can you talk to me a little bit about what does AI really mean? What are the different types, and why are we seeing things that we've been doing in healthcare now fall under this AI umbrella?
Absolutely. So artificial intelligence, AI, it is a game changer. And I say that not lightly, because not just for healthcare, but in just our society at large, in our personal lives. Yeah. AI is going to fundamentally change the way we do things. But because it is going to impact our lives in such a massive manner, well-intentioned companies, startups, investment firms, they are trying to get ahead of that curve. Okay. So they're trying to invest in it today to build something great for that future. But what that ends up resulting in is a lot of noise. Mm-hmm. So I'm sure you cannot go to a single nursing conference yourself where you're not pummeled by sales folks asking you if you would like to see their AI product.
Oh, yes. And they're going to solve all of my problems.
Exactly. In fact, I bet when clips from this podcast go live on, let's say, LinkedIn, you and I will have inboxes filled with people saying, hey, we noticed you like AI. Yeah. Here's some AI for you. I say this in jest, but I don't say it lightly, because there absolutely is a need for us to look ahead and get familiar with AI. So what I would love to do is give a little bit of input, both from us as humans and us as leaders at SSM Health.
That'd be great.
From us as humans, what I would encourage all the folks at SSM to do is get familiar with the tools that are publicly available. Okay. They're not bad. If you feel like there are privacy issues, don't share private information, but go ahead and start using them.
Is that things like ChatGPT or Microsoft products that we are kind of open, that we all can use in our personal lives? Is that what you mean, Saad?
Absolutely. Okay. So, if you're out there and you're surfing the web, you'll begin to notice little call outs for where Google, Microsoft, OpenAI, all these companies that have websites and that you use, they're sort of calling out where they're using AI to respond to you as you search for things. So use them. Try to figure out how best to get the kind of information you're seeking, which is now called a prompt engineering field. Try to figure out how you can actually utilize to get the best results for yourself. Plan vacations, ask for things around, and just get used to it. And I say that only because if you sort of harken back to about 15 years or so ago when smartphones became a thing with the advent of iPhones, you'll remember that initially there was a phase where having an iPhone was somewhat a status symbol and somewhat hey, I'm a forward leaner with technology, so I have one.
That's a great point.
Right? But in those days, the apps you could download had limited utility.
Yep.
Right? I specifically remember this Zippo Lighter app, and one would say, why would you need a Zippo Lighter app on a phone? But it had utility in the sense that you could say, hey, this is so cool and fun. I have this virtual lighter, and when I just blow on my phone, the lighter goes out as if it knows, there's air here. But beyond that, it didn't really do much for you in your lives. Well, now fast forward, and there's less of those show-off apps and more of utility apps, things that you just use. You don't think twice about how amazing it is that a physical card just shows up at your doorstep after you clicking a couple of buttons on your phone. You don't think twice about it anymore.
Right.
Because it is ingrained in your life now.
Yeah. In fact, I don't know how we did without some of it.
Exactly.
Sometimes.
And I promise you, in other ways, because LinkedIn wasn't as popular back then as a professional network social media site. But in many ways, when iPhones were first introduced, all of us were getting sales calls saying, hey, I have something to sell you, and it's based off of an iPhone. It's based off of a smartphone. And not that those folks were wrong or they were lying, but at that point, the maturity just wasn't quite there yet.
Okay.
It did behoove us to get used to smartphones and to become better users of it. That's the personal lives. So for everybody listening, I would encourage you start using these tools.
Okay.
Don't shy away from them. They are going to be embedded in our lives, our personal lives. That's the future. In our professional realm, because right now the utility isn't there quite yet for every single aspect of a modern health system, we have to be a little cautious.
Okay.
Because we do need to play in this AI playground, but we actually need to balance it with risks, our own mission-based ethics formula from an SSM Health perspective, and what we actually pursue and what we do not pursue. Okay. And also, of course, we're in healthcare, so privacy, security, that kind of thing. So the good news is we have AI governance at the organization. We're actually evolving it to what I would say the second level of governance. And we're being very meticulous about how we review things that have AI embedded in them, or are holistically based off of an AI infrastructure behind the scenes. How do we review them that, hey, this is a priority for SSM Health? And so if you start looking at it through that lens, very quickly you realize, well, even in our personal lives, a trusted source goes a long way.
Yeah.
Right? So if you already have an iPhone and Apple put out a new application on the iPhone that can do a few things, you will trust it because you will say, I've had an iPhone. I know that they have a robust testing formula, and I think I can use this app. But if you have a third party that you've never heard of, and they may actually put out an app that might be very, very useful for you, but you've never heard of them, you've never known them, you may be more cautious.
Sure.
Same applies to us at work. And so we have established partners. Our EHR vendor is Epic. Our ERP vendor is, these are systems, core systems for SSM Health, our electronic health record system, our enterprise resource planning system, our HR system, which is Workday. So these are partners and partnerships that we've had for a very long time. AI features and tools through them are a trusted source. And so we can safely say, yes, we should try testing them and try using them. And that also allows a little bit of comfort, frankly, for our leaders.
Great.
Because our leaders are also trying to make sense of this noise.
Yeah, absolutely. So talk to me a little bit about, you mentioned Epic and our EHR system, and there are some tools in there which we're using today. There will be tools that we will adapt and adopt as we move forward in the future. And there are things we have used in healthcare, like predictive analytics, that we've been using for a long time and now fall up under this umbrella term of AI. Can you talk to me a little bit about the difference between something like predictive analytics, machine learning, and then we also hear the term generative AI?
Absolutely. So if you zoom out enough, there's really three main categories of AI as they exist today. The first category has actually been around since the 1950s, and that's what we call algorithmic AI.
Okay.
So the example that I often give is if you're driving by yourself and you put your laptop bag on the front passenger seat, your car will say fasten the seatbelt because it's detecting weight on the seat. That's an algorithm.
Okay.
And the algorithm is basically behind the scenes saying, if there is weight on this seat, warn the driver to put on the seatbelt.
Great.
That sort of AI, and you can call it AI. We call it AI today. Back in the day, we just called them algorithms.
Yeah, exactly.
They've been around for a while. And I shouldn't downplay the complexity and utility of an algorithm. Some algorithms are super complex, have millions of lines of code. So they are actually very, very useful. And for a vast majority of our systems and our personal lives, algorithms are what run them, all the technologies. The second category is machine learning, and it's not as much a separate category as it is building upon the algorithms. And the way it works is, the way that I would give an example is, if there is an unknown process flow, an unknown algorithm that the software or the device that has AI built into it encounters, it says, oh, this is new. I should record it. And now it adds that into its inventory.
Okay.
So it essentially learns from a new variable that is presented to it, and that becomes yet another algorithm that it can pull upon when it's directed to, or when it's asked for it, or when it believes it should. So that's your machine learning form of AI.
Okay.
What has become very popular from the year 2022 onwards is generative AI, and the advent of OpenAI's ChatGPT essentially kicked that off.
Okay.
And that is a different form of AI. And the reason that's a different form of AI is because it generates content that never existed before based on a model underneath it. That's where you come up with things like large language models.
Okay.
Or LLMs for short. An LLM is essentially, I want you to imagine a huge library. You know, a library that you walk into and it's filled with content from authors. And so if you're in college and you have to write a paper on, the innovations in nursing operations, and you walk into a library, you may read a few books. And based on the knowledge you get in your mind from those books, you will write a paper.
Right.
Now that paper will be original, because you are writing it in your own words. And frankly, the combination of the words you use on that paper probably never existed on the planet, right? But that knowledge is coming from other people's knowledge being passed on to you through those books in the library.
Right.
LLM model is very similar.
Okay. That's a great analogy and explanation. I appreciate that. So this concept of predictive analytics, which we like to use in healthcare, and I think about things like falls algorithms or early detection of deterioration in a patient. Where does that fall? Is that machine learning? Is that a basic algorithm? Is it somewhere in between?
It's probably a combination of algorithmic machine learning and generative AI, and different products and different companies approach it differently. But the easiest way to say it is pattern matching is something that humans do very well, naturally. But we have a upper limit for how much information and how quickly we can absorb that information.
Right.
Our artificial counterparts do not necessarily have the same limits as us. And so they are able to not only generate data, but they're able to review data that exists already in way larger scale and scope that a human could.
Right.
When they do that, they're able to tease out patterns that we may not.
Great.
And using those patterns, they can say, okay, if all of these millions of variables were in a specific state, we can predict that this outcome would happen. Whereas as a human, we may be only able to look at 10 variables and say, yeah, I think this is going to happen with this patient. Right. But an AI form counterpart may be able to look at thousands of variables, millions of variables even. Everything from the weather outside to if the ED is full that day, to the nursing staffing, to the physician staffing, to other ways, to look at every single angle of a healthcare operation and say, I can predict that this thing will happen on this floor today. Now, is this a reality? It's happening every day and we are actually working off of this? No. But will this one day be able to model our behavior, our workflows based on what we have in our information, whether there are systems like EHR or whether there's just general events that have happened in the past? Absolutely. One day this will be a reality.
That's great.
A predictive model for falls, for example, is a reality today, but that's very specific.
Yes.
It's very specific for fall prediction. And there's many other uses of AI that are very, very specialized, and a predictive model for falls is probably a little bit more broad than this, but there's some subspecialty AIs that are very niche.
Yeah.
And so then, we as leaders in a health system also have to ask ourselves that question. Where can we get the greatest benefit for an investment that an organization must make in this new technology? And the investment isn't always dollars. Yeah. Actually, more often than not, it's people's bandwidth.
Great.
Our own folks that are doing the work, our own folks that are going through change. So then you ask yourself, well, predictive model for falls would benefit all of our facilities, right? Because we're all going to be worried about falls. But maybe a very niche predictive model for something that is subspecialty, pediatric, interventional radiology with a specific disease in mind, maybe that will not have a wide enough scope of benefit. And that it's not that we should not do it. Anything that improves a patient's health and gives back time, we absolutely need to put on our plate. But maybe that's not as high of a priority.
Okay, that makes sense. So what I think I hear you telling me, Saad, is AI is really a tool and a tool for humans in order to be able to work more productively or be able to process more information quickly. It's not a replacement tool. Is that a good way to think about it?
Absolutely, it's a good way to think about it. And I actually use the analogy, again, going back to the phone. If you picked up the phone one day and you sent me a mean text, which I know you would never do, Amy, it's not the phone's fault that I got a mean text. It was being utilized in a way to deliver content to me that upset me. In the same exact way, AI, as you mentioned, is a tool. How that tool is utilized is up to folks that are, number one, creating and developing the tools themselves, but also the users of the tool, which is us, which is part of the reason we actually invested the time and effort into AI governance upfront instead of catching up to it later at SSM.
That's great. That is great. We have a colleague, and I know you've heard her say this, who says something to the effect of AI will not replace people, but people who use AI will replace other people. And so when we think about AI as a tool, that's a good saying and a good analogy to think through. And it goes back to your point with us in the beginning, which is get familiar with it. Start using it in your personal life. Start getting familiar with how to use it, what applications there may or may not be, and we'll continue to grow and learn in this space, just like we have in other technology spaces.
Absolutely. And we've been through this kind of an evolution in the workplace before when computers were introduced, and that became the sole way we did our work. There was a time in the middle where you could say, you know what, I prefer not to do these activities for my job on the computer. And it was okay because most organizations maintained both ways of doing things for a long time. Again, I'm dating myself here, right? But at some point in time, you could not go to a job interview and say, by the way, I refuse to use computers on the job.
Absolutely. Oh, and I can remember the transition from paper to EMR to EHR, and it was a struggle.
Yeah.
And it is interesting to look back and think about that, but we had lots of ethical questions then too.
Absolutely.
And now I look at that and think, wow, in some ways, now that we've done it, that was kind of an easy transition. It seems that what we're going through today with the conversation around AI is more complicated or difficult or nuanced, if you will. But in some ways, it's the same high-level themes around what are the best applications? How do we keep our data safe? How do we keep our patients safe? And how do we use this tool to enhance the healthcare delivery system that we live and work in today?
Absolutely. And, humans are weird. We tend to not like change.
Yeah.
And that's not a person, a type of professional. That's all humans. But the funny thing about that is we are a physical manifestation of change. At any given point in time, we are forming new pathways in our brain. We are making new memories. Our nails are growing out. Our hair is growing out.
Yep.
So we are walking manifestations of change, yet we dislike change. And a lot of times—
And try to avoid it. Yeah.
And we will go to great lengths to not have to change parts of our jobs, what we do every day, how we think about things. So part of adoption of new innovations, whether it's technology or even operationally, anything new, is just us saying to ourselves, we need to change because the environment is changing. And if we don't change and the environment changes, that will outdate us.
Yeah, that's a great point.
And I think our colleague that says AI will not replace people, people that use AI will replace people that do not use AI is exactly that. If you change with the environment, and make no mistake, the environment is changing and it will change drastically with the advent of AI, then we must also.
Yeah. And one of the things I think is important about change, and one of the things we're going to talk about a lot on this podcast is how we make sure the people who are impacted by the change are shaping the change. So that's our physicians, our nurses, our pharmacists, our other clinicians. And I think that's really important. I'd love to hear your perspective as we think about closing here about how important you believe it is or is not that the clinicians who are involved in doing the work are part of developing things like AI and algorithms and the future work that we know we will all be experiencing.
So fortunately or unfortunately, I've actually seen the result firsthand when the folks that do the work are not involved in a massive change, and it was not great.
Oh, wow.
So we had these laws and policies in the United States towards the end of the first decade in the 2000s, 2008, 2007, called meaningful use.
Yes.
Through these laws, we incentivized the adoption of EHR systems at acute care facilities across our country. When we did that, I was one of the people that was programming EHRs and implementing them. And I remember distinctly, I showed up at this hospital, I won't say which one or which part of the country, and the CIO at the time handed me a physical binder, and it had to have been a few hundred pages thick, and said, "Here you go." And I said, "What is this?" And he said, "This is a printout of all of our documentation templates, nursing and physician. This is a printout of all our workflows in process maps. I need you to go ahead and implement the EHR, configure it exactly so." I thought to myself, naively, of course, now looking back, oh, this is great. What a fantastic customer this is, right? But now I look back and I think to myself, you know, human hands have glided across clipboards with paper on them for decades, over 100 years in medicine, in modern medicine. And both nurses, physicians, and everyone in between have gotten familiar with that. Going left to right, top to bottom, understanding how you're looking at the human in front of you, how you're documenting them. And we said these things that have been chiseled to perfection, both the ways you operate and the way you document, over 100 years or so, go ahead and convert that onto a computer screen. Of course it wouldn't work.
Right.
Right? And so that is a key example to me that we didn't quite understand the change we were going to make holistically. So today we stand at the precipice at SSM Health with the project named Project One.
Yep.
This Project One is our way to use the technology in such a way that it's working for us, that we actually are taking some cognitive burden off of the folks that provide that exceptional care to our patients. But probably the most important to me, and I believe our program office, give back time to the people that provide that care, the people that support the people that provide the care, and of course, most importantly, the patient themselves.
Absolutely.
If we want to make a change that will do all of those things, we must have people that do the work make those decisions. And so we're taking that first step and holding true to that word. We have over 40 work groups come together, work group, just a combination of people that are very, very focused on specific areas, bedside nursing, ambulatory functions, and so on and so forth. And those are composed of altogether close to 500 people from SSM Health that do the job. Now, these are incredibly generous people, right?
Absolutely.
Because they're taking time away from being by the patient's side, from being in our clinical facilities to say, I will give my time, my mental bandwidth to ensure we make the right decisions for this very, very thoughtful and meaningful change. I believe that's how you impart, that's how you introduce change.
Thanks, Saad. That was really a great explanation. And so we've talked a lot about change. We've talked about how we need to use AI, get familiar with it. But there's another question that's lingering out there that we haven't touched upon that I want to ask you about. And that is, people are worried about AI replacing jobs. Now, you've talked about AI being a tool, and we've talked about that together and how it can be useful. But what about this concept and this worry that we see across the country and across the world now about folks being concerned that AI will replace human beings?
I think that's a valid concern. And that's a concern that's almost in the DNA of our society through the different evolutions the society has taken, from the industrial evolution to the information age and so on and so forth. We have always been at the precipice of that fear. are we going to replace our human counterparts with something with a machine, some automation? So the straight answer to that is humans will not be replaced, but the way humans interact and do their jobs will absolutely change. And that change will be painful for some. And I say painful because change in itself is painful for humans. But if your change is changing the way you operate when you have your first cup of coffee in the morning, all the way until you go to home after your day of work, then that's a huge change.
Yeah.
That's your livelihood. That's what you do every day. That's what you've trained for your entire career. And if that's going to change that meaningfully, of course that's scary. Why wouldn't that be scary? And so what I would say is the analogy of mail. At one point in time, all mail was paper.
Right.
Right? And then emails came about. And there was this fear. I still remember it. Will the mail rooms in buildings go away? Well, the jobs that the mail rooms do today have changed drastically. And in many ways, one could say they're more streamlined in both the number of people that work in the mailroom and how much they're supposed to do and how much they don't have to do anymore, because most people not communicate through email, but the mailrooms are still there.
Yes.
In fact, they're augmented by technology.
Yes.
I joke that more often than not, I get an email from the mailroom saying, hey, you have physical mail down here.
That's great.
Right?
Yeah.
Similar thing I anticipate will happen with AI. Some jobs that require pattern matching, that require you to just have a lot of knowledge in your head and sort of recall that knowledge at any given point in time, maybe those will change. And they'll change dramatically enough where you will feel like, are my skill sets being replaced? But the answer there will be they're being augmented in a way where it's drastic enough to kick off that fear, that very human fear. And you will only have, a set amount of options. And the best option for any human will be always, hey, adapt.
Yeah.
This is going to make your life a little bit different, but my anticipation is it'll make our lives a little bit better. And I often say this, and I mean this fully, AI, I believe, will allow humans to be humans again, especially in healthcare.
That's great. And healthcare is a really important place where we'd like to see that happen. Really get back to patient-centered, compassionate, holistic care. And the work has become burdensome over the years. And as a result, clinicians in particular, and sometimes our patients too, unfortunately, feel like that we're spending so much time with the technology that we're not focused on them. So it sounds like we have an opportunity, one, as clinicians, to really be involved in what the design of AI looks like. And two, if we utilize the technology correctly, if we think about where does it make sense to utilize technology and where does a human have to touch another human and have a human intervention, then we might actually can start to create magic in healthcare.
I think so. And we're seeing proof of that already. So here at SSM, we have already begun scaling out a generative AI technology in the clinical space. It's known as ambient clinical documentation. That's the category name. And what it essentially does is, for the longest time, physicians, when they're seeing patients, essentially may as well be the back of a laptop,
right?
Because they have to document so much. The burden of documenting and actually putting things into the EHR became unbearable almost.
Yes, it did.
And I often say in jest, I have a 6-year-old daughter who has this toy laptop. And for the longest time, she would pull out this toy laptop and she would just tap away on it. And she would pretend to be different professions. Sometimes she would say, Daddy, I'm writing you an email. Some days she would say, Daddy, I'm Googling things, right? And of course, it's a toy laptop. It can't do any of that. But one day she looked at it and she was tapping away and I said, are you writing me an email, honey? And she said, no, silly, I'm a doctor.
Oh, wow.
And it occurred to me that there's a generation right now that thinks of doctors, physicians, nurses as nobody else other than a computer operator. That's what people like me have done.
Yeah.
And so something like ambient clinical documentation, it allows you to have a device, an iPhone, whatever we provide, to put it on the desk and just have a human-to-human conversation. The patient can look the physician in the eyes and say, this is what's wrong with me. The physician can have small talk. They can say, hey, how's your son doing? How was his baseball game? And that device, using generative AI, will know what is clinically relevant in that conversation and what is not, and create the right level of documentation in the EHR for the physician. That does two things. Number one, think about it from the physician, also a human perspective. They now get to go home for dinner because they can wrap up their day a little bit sooner. The burden of documentation isn't quite as bad. Secondly, think about the patient. They feel like a human being seen by another human being.
Right.
Again, they can be spoken to like a human about things that are not clinical, their kids,
Absolutely.
their lives. That's what I mean when I say AI will allow us to be humans again.
That's great. And thank you for that. This is such a broad topic. It's a controversial topic. It's a topic we're all still learning about every day, and we'll continue to learn about this. I appreciate that you've spent some time really taking a deep dive in with us. And hopefully we have removed some of the scariness, some of the fear that is out there in our clinical world, and really started to open people's eyes to the opportunities. So for all you clinicians out there, I would leave you with this. Be open-minded. Ask good questions. Think about the ethical opportunities and the ethical constructs with which we should live and work in when we think about AI, and get involved. Be on the forefront in leading your healthcare systems and thinking about how do we utilize AI safely so that it helps humans be more human. Thank you so much for joining me on this episode of Healthcare Disrupted. We want to hear your voice, so dive into the conversation with us. Challenge us and help us disrupt healthcare for the better. Like this episode, subscribe now, and wherever you get your podcast, follow us on this journey.